SAMHSA's concept of trauma and guidance for a trauma-informed approach. This was prepared by SAMHSA's Trauma and Justice Strategic Initiative, July 2014. SAMHSA is the Substance Abuse and Mental Health Services Administration at www.samhsa.gov. Introduction. Trauma is a widespread, harmful, and costly public health problem. It occurs as a result of violence, abuse, neglect, loss, disaster, war, and other emotionally harmful experiences. Trauma has no boundaries with regard to age, gender, socioeconomic status, race, ethnicity, geography, or sexual orientation. It is an almost universal experience of people with mental and substance use disorders, and the need to address trauma is increasingly viewed as an important component of effective behavioral health service delivery. Additionally, it has become evident that addressing trauma requires a multi-pronged, multi-agency public health approach, inclusive of public education and awareness, prevention and early identification, and effective trauma-specific assessment and treatment. In order to maximize the impact of these efforts, they need to be provided in an organizational or community context that is trauma-informed, that is based on the knowledge and understanding of trauma and its far-reaching implications. The need to address trauma is increasingly viewed as an important component of effective behavioral health service delivery. The effect of traumatic events place a heavy burden on individuals, families, and communities, and create challenges for public institutions and service systems. Although many people who experience a traumatic event will go on with their lives without lasting negative effects, others will have more difficulty and experience traumatic stress reactions. Emerging research has documented the relationships among exposure to traumatic events, impaired neurodevelopmental and immune system responses, and subsequent health risk behaviors, resulting in chronic physical or behavioral health disorders. Research has also indicated that with appropriate supports and intervention, people can overcome traumatic experiences. However, most people go without these services and supports. Unaddressed trauma significantly increases the risk of mental and substance use disorders and chronic physical diseases. With appropriate supports and intervention, people can overcome traumatic experiences. Individuals with experience of trauma are found in multiple service sectors, not just in behavioral health. Studies of people in the juvenile and criminal justice system reveal high rates of mental and substance use disorders and personal histories of trauma. Children and families in the welfare system similarly experience high rates of trauma and associated behavioral health problems. Young people bring their experience of trauma into the school systems, often interfering with their school success. And many patients in primary care similarly have significant trauma histories, which has an impact on their health and their responsiveness to health interventions. In addition, the public institutions and service systems that are intended to provide services and supports to individuals are often themselves trauma-inducing. The use of coercive practices such as seclusion or restraints in the behavioral health system, the abrupt removal of a child from an abusing family in the child welfare system, and the use of invasive procedures in the medical system. the harsh disciplinary practices in their educational and school systems, and intimidating practices in the criminal justice system that can be re-traumatizing for individuals who already enter these systems with significant histories of trauma. These program or system practices, or failures I would add, and policies often interfere with achieving the desired outcomes in these very systems. Thus, the pervasive and harmful impact of traumatic events on individuals, families, and communities, and the unintended but similarly widespread re-traumatizing of individuals within our very own public institutions and service systems makes it necessary to rethink doing business as usual. In public institutions and service systems, there is an increasing recognition that many of the individuals have extensive histories of trauma that, left unaddressed, can get in the way of achieving good health and well-being. For example, a child who suffers from maltreatment or neglect in the home may not be able to concentrate on schoolwork and be successful in school. A woman victimized by domestic violence may have trouble performing in the work setting. A jail inmate repeatedly exposed to violence on the street may have difficulty refraining from retaliatory violence and reoffending. A sexually abused homeless youth may engage in self-injury and high-risk behaviors to cope with the effects of sexual abuse, and a veteran may use substances to mask the traumatic memories of combat. The experiences of these individuals are compelling and unfortunately all too common. Yet, until recently, gaining a better understanding of how to address trauma experienced by these individuals and how to mitigate the re-traumatizing effect of many of our public institutions and service settings was not an integral part of the work of these systems. Now, however, there is an increasing focus on the impact of trauma and how service systems may help to resolve or exacerbate trauma-related issues. These systems are beginning to revisit how they conduct their business under the framework of a trauma-informed approach. There's an increasing focus on this. The purpose and approach: developing a framework for trauma and a trauma-informed approach. Purpose. The purpose of this paper is to develop a working concept of trauma and a trauma-informed approach, and to develop a shared understanding of these concepts that would be acceptable and appropriate across an array of service systems and stakeholder groups. SAMHSA puts forth a framework for the behavioral health specialty sectors that can be adapted to other sectors such as child welfare, education, criminal and juvenile justice, primary health care, the military, and other settings that have the potential to ease or exacerbate an individual's capacity to cope with traumatic experiences. In fact, many people with behavioral health problems receive treatment and services in these non-specialty behavioral health systems. SAMHSA intends this framework to be relevant to its federal partners and their state and local system counterparts, and to practitioners, researchers, and trauma survivors, families, and communities. The desired goal is to build a framework that helps systems talk to each other, to understand better the connections between trauma and behavioral health issues, and to guide systems to become trauma-informed. Approach. SAMHSA approached this task by integrating 3 significant threads of work: trauma-focused research work, practice generated knowledge about trauma interventions, and the lessons articulated by survivors of traumatic experiences who have had involvement in multiple service sectors. It was expected that this blending of the research, practice, and survivor knowledge would generate a framework for improving the capacity of our service systems and public institutions to better address the trauma-related issues of their constituents. To begin this work, SAMHSA conducted an environmental scan of trauma definitions and models of trauma-informed care. SAMHSA convened a group of national experts who had done extensive work in this area, and this included trauma survivors who had been recipients of care in multiple service systems, practitioners from an array of fields who had experience in trauma treatment, and researchers whose work focused on trauma and the development of trauma-specific interventions, and finally, policymakers in the field of behavioral health. From this meeting, SAMHSA developed a working document summarizing the discussions among these experts. The document was then vetted among federal agencies that conduct work in the field of trauma. Simultaneously, it was placed on the SAMHSA website for public comments. Federal agency experts provided rich comments and suggestions. The public comment site drew just over 2,000 respondents and 20,000 comments or endorsements of others' comments. SAMHSA reviewed all of these comments, made revisions to the document, and developed the framework and guidance presented in this paper. The key questions addressed in this paper are: what do we mean by trauma? What do we mean by a trauma-informed approach? What are the key principles of a trauma-informed approach? What is the suggested guidance for implementing a trauma-informed approach? How do we understand trauma in the context of community? SAMHSA's approach to this task has been an attempt to integrate knowledge developed through research and clinical practice with the voices of trauma survivors. This also included experts funded through SAMHSA's trauma-focused grants and initiatives, such as SAMHSA's National Child Traumatic Stress Initiative, SAMHSA's National Center for Trauma-Informed Care, and data and lessons learned from other grant programs that did not have a primary focus on trauma, but included significant attention to trauma, such as SAMHSA's Jail Diversion Trauma Recovery Grant Program, Children's Mental Health Initiative, Women, Children, and Family Substance Abuse Treatment Programs, and Offender Reentry and Adult Treatment Drug Court Programs.